Well, first and foremost, when it comes to patients that have, metal toxicity or, silver fillings, also known as amalgams or mercury, we love to inform them of the protocol, how it needs to be safely removed, because as harmful it can be putting it in, it can be just as harmful removing it. Certain things need to have, a protocol, what materials they're replaced with, right? Different testings that we do as far as compatibility, what materials are safe that they're compatible with, less reactive to, more reactive to. So those are the things that we like to inform them with. But my favorite is, when they're nervous and they have that anxiety, that's where, the prayer comes in. And I'll tell them, hey, listen, I know you're worried. I know you've been stressing about, having this removed or this process. I'll ask them, hey, what would you like for me to pray? And they'll tell me, oh, please pray for me because I'm scared. I don't know what to expect. This is new for me, and then we offer, sedation, sedative dentistry, both IV and non-IV sedation. That helps relax the patient, to keep them more at a standstill where they're not, over anxious, because with anxiety and high blood pressure, that can wear out, the anesthesia a lot quicker. So we like to calm our patients and tell them, hey, listen, we see patients that go through this all day, and we're dedicated. Like, we'll set the day aside for them. Even if they're the patient of the day, we'll book, their procedure where there's no interruptions, where we're there focused with more than 3 assistants at a time, including the doctor. Always, reassuring the patient that they're safe. We're monitoring their vitals, taking care of them. It could be a lot. It could be overwhelming because there's a lot of things that help that we do to protect them, for oxygen, that they're not breathing in any toxins, being exposed, their tissue, so completely being isolated, having rubber dams and things like that to protect the soft tissue, their gums. So it's a very, tedious procedure, but we break it down so that they understand, that it's not just, oh, you're in and you're out. There's more to it that goes. In the past, when it comes to, what patients have experienced when it comes to having this type of work done, whether it's removing mercury or root canals, they will see immediate results. Some patients will tell us they have experienced no pain or no sensitivity. Some patients have gone through, different symptoms as far as metallic testing or like feeling as if, they have, a feeling or a pain on their side or on their hip, which we're not saying that is connected, right, to the actual tooth on that side. But there have been cases where a patient was in pain in an area on their body, on their back or on their side, and they so happen to have a root canal tooth or a infected tooth or even a mercury, filled tooth on that side, and they elected to have it removed or have that filling replaced with something more compatible to their body, right, that they're not, rejecting. Because our body tells us, your body reacts to something that is foreign to them. So if there's something that your body is not accepting or, feeling comfortable with, our body is designed to remove those things on its own. So if it's something that is sickness or virus, our body naturally fights those things off. So when your body is and your immune system is working overtime, right, it begins to encapsulate, these areas so that it doesn't travel to any other area, which then forms these pockets or these abscesses. That's where we come in and we say, okay, we need to, address this. Not saying that it's, 100% connected to their symptoms, but because we see that there is an infection or there's something wrong, then we come up with a solution. And then when the procedure is completed, patients will tell us we haven't experienced any pain, I'm no longer feeling sensitivity. The pain that I had in my back has subsided. I mean, almost completely have gone away. And we're like, wow, like, are you serious? Like, are you telling us like the truth? And they're like, yeah, I thought it was because I was under medication or maybe I was getting treatment, but in reality, it literally felt right after the procedure. But yeah, patients telling us that immediate result is just, is shocking. We know it works, but we can't, 100%, say, that that's from this, but I mean, the proof is in the pudding,